Hi, I'm Laura Utech. I'm a family physician here in Ellisville, Missouri, and I'm a Lutheran family physician, and I do see a lot of LCMS members at my office there at the central of the world for LCMS. The purpose of this video and my section in particular are to give you information and inform you about a variety of topics, both physical, spiritual, and emotional, and we hope this is helpful for you. Do you know that there are 7 simple rules to improved health? And these are actually not 7 secret rules like some tantalizing magazine covers may put up for you, but they're really 7 simple rules that probably your mother told you. I, however, was amazed when I went to medical school to find out that these 7 simple rules really have been scientifically proven to prolong your years of good health. Do you know that the average age of health for people in America is 74 years? Now that varies according to gender and according to what race you are, but on the whole it's 74 years. I was horrified to find out, though, that the average age of good health is only 62 years. And that means for a lot of people we're trucking along here with pretty good health, and then between 62 and 74, there are just years of declining health where we're battling heart disease, complications of diabetes, chronic obstructive pulmonary disease, and a whole variety of things that add to the decline of our enjoyment of life and our purpose in life. These 7 simple rules do not prolong your actual years of life, but what they can do is prolong your years of good health so that you, in essence, can kind of just square off your curve. And I don't know about you, but I'm not real anxious to do that slow, slippery slide of 12 years until the Lord takes me home. I would prefer to have a quicker end to my life, I guess, and enjoy more years of productivity and able to do what I feel like I was designed to do. So without much further ado, we'll head on to our 7 simple rules. Some of these I think you can probably guess, and at the top of my list is don't smoke. And if you do, keep trying to quit. They say the average person tries to quit 5 or 6 times before they eventually are successful at it. I also think it's not very helpful to beat yourself up if you don't succeed with quitting smoking, but just to pick yourself up and try something new. Not everything works for every person. There are different approaches to quitting smoking. There are several resources for that. The American Lung Association is a great resource for that, as is your personal primary care physician. So keep trying, and that's probably the single best improvement anybody can make to improve their health and their longevity. The second one is similar, and that's limit your alcohol intake. They used to say when I first started being a family physician that you drank too much if you drank more than your doctor, because there were no guidelines. Everybody just made up their own guidelines for how much was too much. About 12 years ago, a study came out showing that people who didn't drink at all actually had a slightly increased risk of a stroke or a heart attack over the general population. 1 to 2 drinks a day actually decreased that risk. Got past 1 to 2 a day, and then the risks of alcohol far started to outweigh any benefits of alcoholic intake. Now, unfortunately for we women, this is more 1 drink per day. The alcohol content, again, goes according to body size, and with women being smaller body size, 1 drink a day is probably what's recommended for women. And again, 1 drink is 1 ounce of hard liquor, 1 can of beer, 6 ounces of wine a day. I would also encourage you to periodically measure, if you're a wine drinker, how much wine is in your glass. I notice they keep making red wine glasses bigger and bigger, and 6 ounces sometimes does not look like much. So a periodic measurement will help you to stay on top of that. Number 3 is eating well. Many studies keep showing that the more fruits and vegetables you have in your diet, the better off you are. One very large study done with nurses that have been followed for a long time actually showed that the 25% that ate the most fruit and vegetables actually had a significant improvement in their well-being in life, and that's excluding all other factors. I often tell people that if you shop the outside of your grocery store, where the produce is, your meats, your frozen foods, your dairy, and try and stay out of the middle of the grocery store, you're probably in pretty good shape. Basically, it means limiting your white flour, white sugar, and fats that you take in. I know for many people, too, overeating is a significant problem. Gee, we've seen the obesity rates in America flare dramatically, even to the point where we're now treating children for adult onset diabetes and hypertension because of being overweight. If this is something that you struggle with and find that you're not having success with what you do, and you're frustrated and don't know what to do next, I have always been a great proponent of Weight Watchers. It's a sensible program, it's not terribly expensive, and they're accessible throughout the United States. And I honestly, in 21 years of practice, have not found anything superior to that. And I don't get paid by Weight Watchers. I just think they're a great program. Number 4 is exercise. And I have to admit that's not something that comes naturally to me. But when we're looking at squaring off our curve, exercise is probably the number 1 factor to help prolong your years of good life. There are a variety of things that you can do to encourage yourself to exercise more. A favorite of mine is to get a pedometer. A pedometer is a little cheap instrument that you wear on your belt that can count how many steps you walk in a day. The American Academy of Family Practice is recommending that people try and put in 10,000 steps a day, which works out to about 4.5 miles. Pedometers are great for keeping you honest. I used to think that I didn't need to exercise because I was walking up and down the hall in my office, going from room to room, and was quite active during the day, or so I thought. When I put a pedometer on, I was actually only putting in 3,000 steps a day when I was at the office. So it was a great reality check for me that I needed to do more. There are other things you can do to help yourself be faithful to a program. One is to reward yourself. We have a tendency to give ourselves condemnation and slap ourselves and say, oh, look at you, just didn't do what you said you would do. Negative reinforcement has never been shown to be very effective. I instead sometimes advocate sticker charts, that if you do your exercise, you put a sticker up on your chart. When you get 20 stickers, you get to have some reward that you want, such as a book or a special treat. Probably would not recommend food if we are working on that weight loss thing. But some kind of positive thing that you can work toward is a lot more effective. Having somebody that you can exercise with, your so-called exercise buddy, helps you stay accountable too. If you know somebody's waiting for you at the gym or out on the street to go walking, you're more inclined to put on your shoes and get out there and do it. Number 5 is to get adequate sleep. I personally can function on 5 hours of sleep a day, but I don't do well on 5 hours of sleep a day. Successive nights of doing that, and I find myself getting irritable, I find myself getting slightly depressed, and sometimes I don't even think as clearly as I ought to. I think most Americans require 7 to 8 hours of sleep at night, and having a regular bedtime and a regular get-up time helps your body to stay in a regular rhythm that it adapts to and performs well with. So don't cheat yourself on your sleep. Number 6 would be safe. And this is just all of the things that we tell our kids. Buckle your seatbelt, wear your sunscreen. As adults, being careful drivers is so important. All of us have known people whose lives have been significantly impacted by an accident like that just changed their life for good. So be safe. And lastly, establish a relationship with a primary care physician. Your physician can go over your personal risk factors because of perhaps your family genetics. They can update you on immunizations that you ought to have. We as primary care physicians try and make sure that everybody's had their mammograms, their pap smears, as the Cancer Society indicates, a colonoscopy when you're over age 60, monitoring your blood pressure, checking your cholesterol, seeing what kind of things you can do to personally improve your own personal health profile is an essential part of everybody's good health. The second aspect of good health is that of your spiritual health. And I know that there are speakers that are more well-versed in that and can give you more pointed guidelines than a family physician can. But I think 2 very important things are that of ensuring that you have a morning devotional time so that you can talk with God and present your requests to Him. I'm a big fan of prayer journals. I find that if I just try to pray, my mind tends to wander off to a variety of topics. If I'm writing, I have to stay on task. Plus, it's great for me to be able to look back after several weeks and see how God has answered many of those prayers. And I feel just a huge burden go off of my shoulders at the end of the morning when I finish my prayers. I don't have to hold those things anymore. They're in God's hands. I pray about patience. I pray about my kids. I pray about things that I'm frustrated with. And that's helpful for me. The other thing that I find to be tremendously important is an accountability group. I have a small group that I've met with on Thursday mornings for almost 5 years now, and those ladies keep me honest. And I pray that you can find that too. For those of you that are in church work, it may not be with people of your own church, but whatever small groups you can form, be they from your own job or maybe college friends that you can do over the internet, or maybe other pastors' wives or church workers from other church groups. But someplace where you can be honest and get feedback on how people see you pursuing your spiritual path has been invaluable, again, for me, and I think for a lot of people that I know. Emotional health is a big subject, too. We know there are a lot of demands on church workers and that you get pulled from all sides and that your time is rarely your own. I also have read something where people who have a servant's heart or a desire to give and serve other people, which again is a reason that many people go into church work, have a significantly higher incidence of depression than the general population. I want to at least leave you with signs and symptoms of what depression are, so that if you see that happening, again, you can seek help. Depression is considered a state of mind where you feel hopeless or helpless for longer than 2 weeks. And that's right. A day or two of a bad day is okay, but if it goes on for longer than 2 weeks, that's not normal. Some flags for depression are early morning awakening. If you get to sleep okay, but at 3 to 4 in the morning you wake up and you can't get back to sleep, that to me is a red flag to start asking other questions about depression. Irritability, change in body weight, actually either an increase or a decrease in body weight that's not easily explainable. Decreased interest in intercourse or just general decrease in libido is one of the first things often to go. Thoughts of suicide. All of these should trigger you to say, this is not right, I need to get help. And I would encourage you to seek help either through a Christian counselor in your area or, again, your primary care physician. I have a wonderful pamphlet that says, Depression, you don't have to feel this way. There are wonderful medications out there now besides counseling resources that are not addicting, that don't get people into trouble. And if they can help you, I think you should take advantage of that. There are lots of other resources that are available for you. One that you actually may already have is this Health Quest Guide to Self-Care. I believe Synod gave these out several years ago. Great little resource that has got a lot of other information for you. You can also buy books at Borders, such as the Merck Manual or the American Medical Association Guide to Family Health Care, that I find to be great resources and help to answer questions on when do I get worried about something. There are, of course, a lot of great internet sites also. WebMD is used by a lot of people, and that's a reputable site. MayoClinic.com is full of great resources. American Family Practice has got information for patients. Another resource can actually be accessed through Concordia Health Plan Services. There's a link on the internet that can direct you to that website. So invest in your health, take plans, take steps to improve your health, and be a partner with your primary care physician in helping you square off your curve.